Excited to be talking about the Surgeon General's call to action to support breastfeeding. We usually do announcements and such, but we realized that we don't have any right now that we can think of, but there are some things at the end of the presentation that Larry will mention that are announcements within themselves. So we'll wait until that point to talk about those. It is my pleasure to present. I'm not presenting, but Larry will be presenting, and to my pleasure to introduce Dr. Lawrence Grummer-Strawn. He will be talking today about the call to action to support breastfeeding, and he is the branch chief here at CDC in the Division of Nutrition, Physical Activity, and Obesity. So I will turn the time over to Larry.
Well, good afternoon, everyone. It's good to be able to share with you some information about the Surgeon General's call to action to support breastfeeding. This has certainly been an exciting month for us to get this document out and shared around the country. It's been a very active year indeed, but certainly seeing it come to a culmination in the launch of what we see really as a seminal report for the country on breastfeeding has been quite exciting. Go ahead and go to the second slide, please, Megan. Today, I'm going to talk about the call to action, but particularly talk about what it means for state coalitions. In the call to action, the Surgeon General really has called upon many actors across the country to take on a variety of different activities to provide better support for breastfeeding. Their activities directed at many levels, whether it be federal, government, whether it be state and local governments, whether it be individual people, whether it be employers, organizations, hitting at many different levels and many different types of actors throughout here. Our focus today is to really see how coalitions themselves can take action. Sometimes that action may be spurring on other actors, and sometimes it may be coalitions themselves taking action on their own. Let's go to the next slide, please. Just want to lay out some of the kind of key aspects of the document, just kind of understand what it is and what it isn't. The title is the Surgeon General's Call to Action to Support Breastfeeding. The choice of the word support was very intentional. This is not to all things about breastfeeding. It is not a literature review of the benefits of breastfeeding or the importance of breastfeeding. It's not about telling women that they have to breastfeed. It is about how we can provide better support to women who do choose to breastfeed. It's focused on what recommendations do we need to make to change the environment to be more supportive of breastfeeding. What policy changes are needed, what environmental changes are needed. It does not really focus in on clinical recommendations. It doesn't talk about how we should breastfeed, how long we should breastfeed, when we should introduce solid foods. We feel that those are recommendations that are made by professional clinical audiences or clinical groups. This document really is about how do we change the environment to be more supportive. It takes a long time horizon. As we'll talk about in a moment, there's a long history of documents coming from the federal government calling upon changes in action on breastfeeding. And these tend to come out like every 10 years or so. So this is not the short-term plan, what are we going to get done in 2011. This really takes a long-term horizon, trying to look over the course of the next decade, what are the kinds of changes that we want to be seeing in our environment. The document lays out a number of opportunities for how we can change the environment in a positive way. We often focus in on the negatives, what's wrong about the environment, and certainly the document has to frame what is wrong with the environment as defining the barriers that we're trying to address, and that's certainly an important part of the document. But the call to action itself is not berating anyone. It's not telling anyone what they're doing wrong now. It's very much an approach of how do we move toward positive change to be more supportive. And as I mentioned in my introduction, there are a wide variety of entry points to make these changes. Sometimes they are individual actors that we call upon. Sometimes they are systems that need to change to make it possible for those actors to take actions. Sometimes it's funding. Sometimes it's new laws that are needed. There's quite a wide variety of entry points. Next slide. I want to take a little bit of discussion just of kind of the frame of how the document itself is laid out, so that if you're looking for things in the document, you'll know where to look. We start off by talking about the importance of breastfeeding, and we talk about it from a variety of perspectives: health, psychosocial benefits, economic benefits, benefits for the environment. When we talk about the health benefits, we made a very conscious decision in framing this document that we were not going to be looking for a new literature review. We were not going to be writing a long time on a variety of different benefits that might be important. Instead, what we wanted to do was use systematic reviews of the literature that have already been published. We've had criticism that sometimes breastfeeding advocates get too excited about one benefit or another, and they don't do a balanced review of the literature. We wanted to avoid any criticisms like that. And so we looked to previously published systematic reviews to decide what would we include in our list of the importance of breastfeeding and its health effects. We framed these health effects in terms of the excess health risks associated with not breastfeeding. It was important that we establish that breastfeeding is the norm. The norm in this country, it's the norm for human biology, and we want to hold that up as the standard against which we should compare what happens if you don't engage in breastfeeding. And so the benefits that are presented here are actually presented in terms of the excess risk of not breastfeeding. Next slide. I also just wanted to point out the long-term history that we have on federal policy on breastfeeding. The Surgeon General of the United States has been involved in breastfeeding for a number of years. Going back to 1984, we just celebrated the 25-year anniversary of Surgeon General Koop's workshop on breastfeeding. And what you'll notice in here is that the same issues that we're dealing with today are the issues that were dealt with 25 years ago. Work, education, professional education, healthcare systems, providing the supportive services that women need, and a research environment. We've reframed them a little bit in a different organizational structure, but we're still dealing with the same areas that we need to make changes in breastfeeding. In 1990, the United States signed on to the Innocenti Declaration on the protection, promotion, and support of breastfeeding, a seminal event laying out that the United States is part of the international agenda on promoting and supporting breastfeeding. And then about a decade later, we had the HHS Blueprint for Action on Breastfeeding. We really see the call to action as the next in the series of HHS documents calling out for new policies to be more supportive of breastfeeding. Next slide, please. The next section of the call to action deals with rates of breastfeeding and disparities. We point out here that while breastfeeding is the norm in this country, because 3 out of 4 mothers do initiate breastfeeding, we also see a dramatic drop-off in rates of breastfeeding. And so by 6 months of age, only 43% of women are still breastfeeding at that point, a very rapid drop-off. And in terms of disparities, we see that those rates are considerably lower among non-Hispanic blacks, among WIC participants, among those who have not yet completed high school or have not gone to college. And so while we want to address the issues for everyone in this country to be more supportive, we need to particularly focus our efforts on those populations that do not breastfeed as much, those low-income populations, African Americans, less educated populations. Next slide, please. So we know that rates drop off of breastfeeding. We next move to a section in the call to action that really lays out, well, why? Why don't women breastfeed? Why do they stop breastfeeding at earlier ages than would be recommended? And here we do have a new literature review. We went through a long literature to really try to understand what are the barriers, what is keeping women from engaging in the behaviors that we know are more healthy for their children, and by and large that they also know are healthier for their children. And we identify many areas in which there are barriers to breastfeeding. Lack of knowledge about how to breastfeed, social norms that hold up bottle feeding as the standard way and that there is something strange about breastfeeding, family and social support that is not present in supporting breastfeeding, issues with embarrassment, issues with lactation problems that creep in the first few days and weeks of breastfeeding that make it difficult to continue breastfeeding, employment and childcare issues that interfere with the continued duration of breastfeeding, and a number of barriers related to health services. Next slide. So we take these areas and we talk about not just what is wrong with the country right now, what are the barriers that we're facing, but we also try to then move this into a public health perspective. What can we do about it as a public problem? We don't want to just point to this person is not doing the right thing. We need to frame it as a public health issue of what is it that we as a society can do to change the way we address these issues. And so that we have a section on the public health perspective around breastfeeding. And we look for what are the opportunities where we can make a difference. We describe what's already happening, many programs related to breastfeeding, and we show where there are gaps in what is happening right now and the opportunities that we have for making a difference into the future. This section and the call to action itself is framed in, those two sections are both framed in terms of these 6 categories: mothers and their families, communities, healthcare, employment, research, and public health infrastructure. Now, as you think about those different categories, you can see them as elements of the socio-ecologic model. Obviously, mothers and their families are at the center of that model because it is the behavior of mothers and their babies that we're trying to affect, but there's a huge ecologic model that has impacts on those. Next slide, please. So here you see a schematic of the socio-ecologic model, holding the mother and baby at the center of the model, but with the many forces that impact upon her, moving out from those that are most closely related to her, her social network, moving out then to other people who may not be her closest friends, family, that have direct impact on a day-to-day basis, but that do impact on many of the decisions that she makes. Moving out to the many places that she operates in, the organizations that have some impact on her. And then as we move out to the outer rings of the circle, we start dealing with the institutions that set the policy environment, that set the information that she might have available to her, that shape the kinds of environments that she lives in. In this document, in the call to action, we really have the bulk of the focus on the outer rings of the socio-ecologic model. While we do talk about the mother and baby, we're not really saying what the mother and baby need to do. We talk about how the mother and baby need to reach out to the outer rings of the circle to seek out the kind of help that she might need from her friends and family members, the kind of communication that she needs to have with her employer and with clinicians so that she can receive the kind of help that she needs. Most of the action steps themselves and the implementation strategies really focus on what can be done in the outer rings of the socio-ecologic model. Next slide, please. I'd now like to move into what, in the end, we actually do call for action on. As we shaped the actual steps in the action plan, we had to be somewhat selective. There were many ideas that were sent in through public comment, through the various hearings that we held, with stakeholder hearings, expert panel meetings, to define what were the most important priorities for us to look at in supporting breastfeeding. We had to be selective. We started with the category of mothers and their families, kind of starting at that center of the socio-ecologic model. And the first is to support breastfeeding mothers. So we talk about how we all as a society need to provide better support to mothers, but we also talk to mothers about how they need to ask for help. We're not telling them that they need to breastfeed, but we are telling them that if they want to breastfeed, they need to tell their family members. They need to develop a plan for the kind of help that they need. Next, We talk about developing programs to educate fathers and grandmothers about breastfeeding. Talk about the kinds of campaigns that could be done in communities to reach out to fathers and grandmothers, and how classes should not be oriented only to mothers themselves, but to their family members as well, so that mothers can get that kind of help from their closest social networks. Next slide, please. The next strategy is in the area of communities. We have 4 strategies here. The first is to strengthen programs that provide mother-to-mother support and peer counseling. We've seen huge expansion in the WIC program of peer counseling, and that's underway right now with new dollars that are available to us. But we're calling for action to go beyond WIC. We need to reach out beyond just the WIC community to reach women that are not served by WIC. We also need to shore up the resources within WIC to make sure that it is a core service available within WIC and is available to all WIC clients, not just those whose administrators decided that they wanted to apply for dollars into their program. The next action is to use community-based organizations to promote and support breastfeeding. The primary focus here is on communities of color. It was clear in the build-up to the call to action that we needed to have ways to address the specific issues in communities of color, low-income communities. We talked about ways to provide breastfeeding support to programs that are already serving in these communities, but also to build new programs of support, new breastfeeding integration into the community-based organizations. Next, we talk about creating a national campaign to promote breastfeeding. It certainly can be national, but also can use state campaigns and move forward. We talked a lot here about needing to use not just the traditional media of television and billboards and radio, but to really reach out to the newer venues in the internet and viral marketing and such, to really take advantage of many sources of media to reach young women and their families to promote breastfeeding. Next, the next action step was to ensure that the marketing of infant formula is conducted in a way that minimizes its negative impacts on exclusive breastfeeding. There are actions to be done here that impact at the national level in terms of monitoring compliance with the International Code for Marketing of Breast Milk Substitutes, but also actions that can be taken by individual clinicians, that they can see that they are not serving as advertisers for infant formula companies, either explicitly or inadvertently, just in the kinds of pens that they use and the posters that they put up and the materials that they disseminate to their clientele. So many ways that we can work on improving the formula marketing environment. Next slide, please. The first action step under healthcare is to ensure that maternity care practices throughout the United States are fully supportive of breastfeeding. Primarily what we're talking about here is accelerating the implementation of baby-friendly hospitals. We need to change the entire environment in the maternity care wards. We know that there are many barriers that exist there, and we know that we have international standards for what is expected for optimal maternity care. And yet, we're at the situation now that only 3% of births are born into facilities that are designated as being baby-friendly. So a big push from the call to action is to really accelerate our implementation of this international strategy. Next is to develop systems to guarantee continuity of skilled support for lactation between hospitals and healthcare settings in the community. We know that all breastfeeding doesn't get established in those first 24, 48 hours in the hospital. And while there is much that needs to be done in the maternity wards, we also know that they have to have that step 10 of reaching out into the community to make sure that we get the continuity of care as women are discharged from the hospital. This is going to require significant partnerships between community organizations, outpatient care, and hospital care. We need to make sure that there is seamless care, not just allowing women to go and find their own way through a very complicated system in their own communities. The next action step is to provide education and training in breastfeeding for all health professionals who care for women and children. The real focus here is on all healthcare professionals. We did not want to be selective that we were only talking about pediatricians we were only talking about women who work in the prenatal or postpartum area. We know that there are many issues that impact on breastfeeding throughout a woman's lifespan that may impact on her ability to breastfeed, her desire to breastfeed at some point in the future. And we know that we need to have children's providers also supportive of breastfeeding, and they need to be educated in that. So we want to reach out to all health professionals that interact at that level. The next action step is to include basic support for breastfeeding as a standard of care for midwives, obstetricians, family physicians, nurse practitioners, and pediatricians. If it's not built in as a standard of care that is expected at all of these health professionals, then we know it is going to be a hit or miss. Some physicians will provide the kind of care that they ought to, and others will not, maybe based on their own personal interest. And so we have to have quality standards of care. The next action step is to ensure access to services provided by international board-certified lactation consultants. The issue here is to deal with both reimbursement issues as well as increasing numbers of IBCLCs so that women who need to find services will have a decent access to those who can provide those services in their communities. The next action step is to identify and address obstacles to greater availability of safe banked donor human milk for fragile infants. This is an area that certainly will take some national infrastructure building. But we also know that we need further research in this area to better understand the importance of banked milk, how banked milk ought to be handled, what are the various barriers. And I'm happy to say that FDA has already begun a number of activities to move forward in this area. Next slide, please. We had 4 action steps in the area of employment. The first was to work toward establishing paid maternity leave for all employed mothers. I'm sure you're all very focused on that word paid, and that was very much a focus of our attention here. Unfortunately, we do use the word work toward because we recognize that immediately it is not going to be possible to pass a law in this country for paid maternity leave, but there are various steps that can be taken to work toward that direction so that all women who are in the workforce will be able to continue to breastfeed their babies without being concerned about loss of pay. To work toward that, one step that is key, that is certainly important, is to develop further models for funding. What are the funding mechanisms by which we could pay for maternity leave? There was a lot of concern in developing the document that this would all be put on the shoulders of the employer. And we understand that that creates many disincentives for employers and that we need to have other funding mechanisms such as state insurance programs that would ensure that all women can take advantage of such a benefit. We currently have 5 states that have models, and we need to see more states adopting models that can make this into a reality before it can become a federal reality. The next action step is to ensure that employers establish and maintain comprehensive, high-quality lactation support programs for their employees. Certainly a beginning step of this is to implement the new law under the Affordable Care Act that ensures that all nursing mothers need to have break time and a place to express breast milk at the workplace. But we don't want to stop there. We want these programs to be more comprehensive and ensure that they can reach beyond just expression of milk at the workplace. Moving us to the next action step, which is to expand the use of programs in the workplace that allow lactating mothers to have direct access to their babies. What we're talking about under direct access is that the mother can actually go to her baby during the workday, or the baby stays with her at the workplace. So bring your baby to work activities, on-site daycare, these kinds of things that need to be expanded so that we're not always relying on express milk as the only way to continue breastfeeding. The next action step is to ensure that child care providers accommodate the needs of breastfeeding mothers and infants. What we found here was that we already have standards in the Caring for Our Children standards developed by the Maternal and Child Health Bureau that set forward what are the standards for how breastfeeding ought to be accommodated in child care. However, not all states have adopted these standards, and we need to ensure that this is taken on by all states. Next slide, please. Moving forward to research and surveillance, we recognize that there is a need for increased funding as well as capacity for conducting research. There are many research questions, and we focus some of the research topics in the document dealing with breastfeeding rates, how to increase those rates, the economics of breastfeeding, and questions on management of breastfeeding. We really need to know what is it that is needed in this country to really make a difference on how to help women with breastfeeding. The next action step is to develop a national monitoring system to improve the tracking of breastfeeding rates, as well as the policies and environmental factors that affect breastfeeding. We know that we need better surveillance, but we particularly need to focus in on tracking what we're doing about how to support breastfeeding. We know that there are many policies and environmental factors that are important, but we often don't have tracking systems to know whether or not we're actually being effective in changing those policies and environmental factors. Next slide. And the final, the 20th action step, is to improve our national breastfeeding leadership on the promotion and support of breastfeeding. We need better leadership from the federal government. We need more support for the U.S. Breastfeeding Committee so that we can all be working together on a common agenda for breastfeeding and have worked through what are the issues that we all need to be focusing attention on. Next slide. So that's enough by way of overall background on what is in the document itself. Let's take just a few minutes to think about, so what does this mean for coalitions? Next slide. I would encourage you all to focus on a couple of different tools. First of all, access the document and look particularly to Appendix 1. Appendix 1 takes all of these action steps that I just went through and the 52 implementation strategies that are organized under each one of them and lays out in only a few pages what is it that we're really calling for action upon. We've taken that same appendix and passed it out to you as a handout for today's talk that we're calling kind of an implementation matrix. It's the exact same information that is in the Appendix 1, which is on pages 71 to 77 if anyone is looking at the document right now. We've taken that same information, but we've laid it out into a matrix format so that you can, at a glance, see who the actors are. As you as coalitions are thinking about what actions should you take on, I think a first step would be for you to think about, well, what are the things that we've already said are the entities that can take this action on? And I would encourage you to focus on a few columns in particular where we've placed X's. Public health entities. You as state breastfeeding coalitions are public health entities. So look to those items that we call upon public health entities to take action. These are areas that might be places for you to start. You also have a lot of interaction with community organizations. So another column to really focus in on is community organizations. And of course, anything that says state. We know that you're connected to state legislatures, you're connected to state health departments. Anything that has state in its title is an area that may be of particular interest where your state can take action as part of the call to action. Also encourage you to look at the executive summary, which is also available online. The executive summary takes each of these action steps but puts them on a single sheet of paper, a foldable, it's really 4 pages, but it's a single sheet of paper that you can easily pass out to people to encourage them to focus their attention to what is it that they themselves can do to take action. Where can they plug in? They don't have to have the entire 100-page document to find places that are of relevance to them to take action to be more supportive of breastfeeding. Next slide, please. As you're doing your own planning within your coalitions, we'd encourage you to look to the call to action for what are the key priorities that you should focus attention on. As you're doing that, there are a variety of things you might want to think about. What actions are going to have the greatest population impact? Are you going to be able to reach your entire state, or is this something that's only going to be for a small handful of women? We really want to get the largest reach out of whatever we do as possible. Think about what you're already doing. What efforts are underway? What partners do you already have existing relationships with? What personnel do you have and the skill sets that they have? What financial resources do you have at your disposal? Those will help you decide what are the things that are reasonable for you to take on. But also think about what is potential. Are there partners that have an interest in breastfeeding but have not joined your coalition yet? Are there financial resources that you might be able to tap into now that you've seen the call to action and you see certain actors that maybe you hadn't thought about before? Of course, one of the most important things in terms of what you're actually going to be able to do is what are you most excited about? Where's your passion? What are the interests of your coalition members? Because if they're passionate about something, they'll put so much more energy into it than if you bring them along kicking and screaming. And finally, what's the politics that you're working in? Some states may have the ability to really do some new and exciting things and really push forward new legislation. Others may find that their winnable battles are at much smaller levels. You need to know your own political environment, what's feasible for you to get accomplished, and how do you move forward. Next slide, please. As we at CDC thought about these various issues, we pulled out 5 of the action steps and 1 or 2 implementation strategies under each of those that we thought were particularly relevant to many state coalitions right at this time. First, we pulled out Action 3 to strengthen mother-to-mother support options. Here, the action step really focused on creating support groups and peer counseling programs. What can you do on this? One of them certainly is to provide more support to the WIC program. We know that while there are large resources coming from USDA to support this program, not all local agencies have shown an interest. They're not necessarily applying for the funds that are available to them. If we're going to get peer counseling to happen throughout WIC, we need to have all local agencies applying for those funds. But outside of WIC, we need to be reaching out to existing community structures. Think about faith-based organizations, parenting groups, child care centers. What are those groups that bring new mothers together and would be an opportunity for creating mother-to-mother support groups around breastfeeding? Next slide, please. The next action step we thought you might want to focus on is Action 7, improving maternity care systems. Here, as I mentioned before, we're trying to accelerate the implementation of the Baby-Friendly Hospital Initiative. Various things are happening, I know, in many states right now. Statewide summits bringing together CEOs of hospitals. State collaboratives bring hospitals together to look at quality improvement as a group. Training that goes out to various hospitals. We have calls every 3 weeks here with our funded CPPW partners that are utilizing the various funding opportunities coming from CDC to focus attention on maternity care practices. One particularly innovative strategy that I know is moving forward in some states, and has certainly been something we've encouraged through this CPPW, is to think about pay-for-performance for baby-friendly hospitals within Medicaid, by which hospitals that are designated as baby-friendly hospitals might be able to receive a higher rate of reimbursement for all the deliveries in their facilities. The next strategy is to develop effective lactation care teams. We're talking about how to get better reimbursement for IBCLCs, and including lactation as an important essential medical service. Here we need to work with major healthcare chains within your state. You know who your providers are. Who are the main people who need to change policies in terms of essential medical services and what is defined? Change policies with regard to what is required for reimbursement of lactation services. One major issue here is licensure. We know that it would be easier within Medicaid if IBCLCs were a licensed profession. They would be easier to justify reimbursement. We also could work with the state Medicaid offices to find other options for how can lactation services be better reimbursed. Next slide, please. We also picked 2 areas within employment. Action 13, moving forward on paid maternity leave. As I mentioned earlier, we need to establish funding mechanisms for paid maternity leave. We need more examples than just the 5 states that are doing this now, to show us how can we, in fact, pay for paid maternity leave as a state program. And finally, Action 14, ensuring that lactation support is available for all employees. We've had a recent teleconference about the new standards within the Affordable Care Act working through the Department of Labor. You in your states can work with your own state Department of Labor to find out how the new law is going to be implemented in your state, how it is going to be enforced. We need to compile success stories of what employers have done so far in applying the new standards in the ACA bill. Particularly, we need success stories in non-office-based settings because we have lots of examples how office workers can be accommodated with breastfeeding, but there are so many other settings in which women work, and it's not necessarily as easy to figure out how to accommodate breastfeeding. We also need to work on communicating to employers about the new ACA bill, and you as state coalitions can be developing those ways of communicating to employers within your own states. Next slide, please. So where do we go from here? I think we're all looking to the call to action as ways to frame our future activities in breastfeeding, use it as an advocacy tool to push us forward in areas that we've wanted to do for years but needed an extra impetus. We now have the Surgeon General of the United States calling upon all of us to do more to support breastfeeding. Various activities are coming up that may be of relevance to people. Here at CDC, we'll be doing a training at the end of March, bringing together those funded communities and states that will have breastfeeding training sessions focused particularly on maternity care practices and employment. At some point in the future, depending on what happens in Congress, we anticipate that CDC will be putting out new funding announcements for both states and for communities, and would include breastfeeding as part of the activities that are eligible for those funding. They would not be funds directed exclusively for breastfeeding, but breastfeeding would be on the menu of activities that can be funded. Coalitions need to be paying attention to the funding announcements and collaborating with people at the State Health Department who would be writing the applications for those funds. If you don't include breastfeeding activities in your application, we can't fund breastfeeding activities for you to do. In terms of the Department of Labor, they currently have open a comment period about how the new law ought to be implemented. That is open until February 22nd, and you can go to the USBC website to actually put your comments in. We actually need many comments in favor of breastfeeding so that we don't find that all we're getting reported to the Department of Labor are people who are complaining about how difficult it is to implement this new law, and becomes then a force for people who might want to repeal the law to use against us. We need to make sure that we have many positive comments about how important the law is, how feasible it is, how it can be actually implemented to the benefit of both employers and of women. Also remind you that CDC every year puts out a report card that tells states how they're doing on a variety of indicators related to the supportive environment on breastfeeding. So those are just a few of the things that are coming up into the future. I know many of you are looking for kind of what are the future materials available, when will you get printed copies of the call to action. We have the document off for a second set of printing now. We had to do a very quick printing for the launch, and those documents have been disseminated but did not go out to the state coalitions. We are working with the printing now, and so later this month, all of you should be getting a stack of hard copies sent to your coalition and your state health department.
Larry, I just want to butt in because Megan actually sent out a form to the head of each coalition asking how many copies you'd like. So if you haven't contacted me, Jessica, in some other form already, please fill out the form that Megan sent out to all the coalitions and put in how many you'd like of the executive summary and the call to action, and we'll get those to you as soon as possible.
The final thing I wanted to mention is that we encourage all of you on your regional calls to be talking about how you in your own region of the country can move forward on the call to action. It's an opportunity for networking of ideas, that come up in one state that might be shared somewhere else, things that people are doing in one state that others could be picking up on as well. So please take advantage of your own regional and state collaborations as ways to implement this call to action and keep us moving forward supporting breastfeeding. I'm going to stop my presentation at that point and open this up for any questions that there might be. I think you can send in your questions either on the telephone line or it can be typed in messages, and Megan will be able to filter those for us.
Yeah, can you hear me, Larry?
Yes, I can.
Oh, wonderful. This is Megan, and I just wanted to confirm that, yes, you can ask questions on your webinar screen on the computer. And on the right-hand side of your panel, you have a box that says questions, and you can type in questions there. I do have a couple already, but I did just want to follow up to what Jessica was saying and answer one of the questions I can answer. I will, after this call, send a reminder with that link to the form. I did send out, as Jessica said, a sign-up/order form for ordering copies of both the executive summary and the full call to action document. And we ask, just think about how you might use those. If you're having a coalition meeting today, this might be a good thing to discuss how you might use those two different types of documents and how many you might want to order. So I'll send out a reminder with that link. It goes to the designated contributors. That's the 3 people from each state coalition that have designated themselves to us. So you'll get that. And then the questions also was, will the audio and PowerPoint be available so you may disseminate it to your other partners and others who may not be able to attend today? And the answer to that is yes. We always have the audio posted as well as the PowerPoint and the slides handouts that Larry mentioned, that socio-ecological model and the implementation chart. All of that is posted on our website as usual. The audio will be posted within about 24 hours after the call. It just takes a little while to download and be converted to a regular size file. So I will make sure that's posted and send you a reminder with that link along with the form to order copies. So do watch for that. I'm getting some more questions here, so let me just peel through what I've got. Here's an easy one. What is the CPPW?
The CPPW is the Communities Putting Prevention to Work program. This was funds that CDC received through the stimulus bill, the American Recovery and Reinvestment Act. They were sent out to state health departments and communities throughout the United States for, it was one-time funding for 2 years of activities. The funds have all been disseminated, but the activities are still ongoing in all 50 states and select communities across the country.
Great. And a related question is, what is the timeline for potential CDC funding to state health departments? I don't know, is that something we know yet?
I do not know the answer to that yet. Both state funding and community funding is pending what happens in Congress. There are issues with the overall budget that CDC gets, that we do not yet have a budget. We're on a continuing resolution, so that's part of what's in question. And there are also funds that are available through the Affordable Care Act. And as Congress talks about repealing portions of that bill, they could have financial implications on CDC. So at this point, we don't know how much money nor the timing of when that money would be going out. But if it does come, the expectation is it would be later in this fiscal year.
Okay. And I also just wanted to emphasize what Larry said about preparing for that. If you are not one of the states that is currently funded for CPPW work on breastfeeding, it would be a really good time now to start making those connections with your state health department, your community, your county health department, to get ready for that, because we are expecting, as Larry said, that there will be new funding, perhaps through a different mechanism, but we need to form those partnerships and be ready when that announcement comes out. So another thought I just wanted to bring up, we are, as we've been working on revamping our Coalition's electronic forum and getting ready to launch a similar type of an implementation matrix that might be useful to coalitions as they're thinking about some of these action steps and implementation strategies. So one thing we could do also on the forum, if CDC is amenable to this, is to have a section where we can link up states that are doing existing CPPW projects, both to talk amongst themselves and also to talk with others who might be interested in applying for some of the future funds. So that's just a thought, but we do have different sections under the Coalition's forum, and if you haven't gone onto it lately, I would encourage you to go check it out because it is divided up into the sections, the call to action, the healthcare and employment, and so on. And we'll be doing some revamping to just sure that it does match the new sections of the call to action now that it's out, and some new things will be going up there. So,
certainly we have no objection to continued networking across communities, and so those who are funded by CPPW to do breastfeeding activities are able to use the Coalition's website for ongoing networking. That'd be a great idea.
Yeah, we can talk about how to make sure all those people are accessing it, but I think that's one way that we can work together. One other question I saw, can you share more about the August conference? And I'll just answer that one very quickly. The Coalition's conference is scheduled for August 4th through 6th of 2012. Once again, that's August 4th through 6th, starting on Saturday evening like we usually do and going through Monday lunchtime. We are in the very early stages of planning this in terms of finalized location, but it will be in the Washington, D.C. metropolitan area, and we do that also so that we can, after the conference has ended, go and have a lobby day on Monday afternoon. So same structure as before. So like I said, we're in the very early stages of planning, but we do, of course, expect that it will mirror the, and really focus on the implementation of the call to action. So be watching for that, and we will have more information this spring and summer, including the abstract deadlines and so on will be coming out. So let's see. Is there information on strategies to address women's sexuality and body image concerns related to breastfeeding?
This was not an issue that we took up in the call to action, so I really can't speak to that today. It was an issue that I think was brought up in a couple of public comments, but it was not something that we put forward as a priority action.
Mm-hmm. Well, it was addressed though in the embarrassment, where you talk about embarrassment barrier. It is mentioned there, but
yes, as
a little bit, but not in terms of the active strategy. Yeah, as a barrier, but not as an action. Okay. Let's see. Okay, there are a lot of. This is one that we can also put up out on the email list or the Coalition's forum, but which 5 states have established the funding mechanisms for paid maternity leave? Is there more information about how they went about doing this?
They're listed in the call to action itself. I'm trying to see if I can get to that page quickly. As far as the stories behind how they got there, we have not kind of put up what the case studies of how that came about. I think we would probably have to follow up with each of those states and see if we have some kind of history behind it. But those 5 states are California, Hawaii, New Jersey, New York, and Rhode Island.
Okay. Is there any evidence to suggest that breastfeeding rates are higher where employees have a policy to bring their babies to work? Now, this is one we've been asked by some journalists recently, too.
I am not aware of any specific research that has looked at that question. Just in general, I will say that the research base for employment and breastfeeding is much weaker than we would like. We have a few very good evaluation studies, but it's only a few. Whereas in the kind of healthcare sector, we have a whole lot more trials where people have tried things and tracked breastfeeding rates. We would encourage much more research related to employment and breastfeeding.
There's also the good evaluations that have been done of the employment programs show the increase in rates among their employees. But I venture that that question is about sort of the surrounding community beyond just the employees of that particular employer. But the evaluations that do exist do show
increased rates among employees of those organizations.
This one is specifically about one of the handouts. We use some of these slides in our own presentations that we do for outreach. For example, the diagram of the mother and baby vets. And I just want to answer first that part, that the diagram and the implementation chart are available on our web page as handouts, specifically as PDF files. So those are easy to get to. I'm going to rephrase this question because I keep getting asked this, Larry and CDC friends. Will they be able to use any of these slides? And the second part to that question is when we are being asked or when coalitions are looking for someone to present locally about the call to action, who would you suggest or how would you suggest they handle those speaker requests?
We certainly have no objections to anyone using the slides from this presentation in any way that they see fit. We have had communications with the communications team within USBC about making a slide set available for community presentations. I think they would, what we've talked about is kind of using this as a starting point, but putting kind of a more of a community flavor to it rather than a coalition's flavor to it, of the things that are most important at that level. There might be a few things that we want to clean up about this presentation, but that's something that we're moving forward with USBC on. I don't know that we have a specific timeline. I'd say hopefully within the next 4 or 5 weeks, we would have a kind of standard presentation that could be used in communities.
Okay, and then we can send that out when it's ready. And then what about, I have gotten some speaker requests, and I know many people are asking that question too.
I think if people have a need for it in a shorter time frame and they just want to use these slides and play with them in PowerPoint, we can certainly make them available in PowerPoint, not just in the PDF.
Okay. Let's see, this is a long question. We understand, this is from Karen Farley in California. We understand from our Medi-Cal staff here in California that they are looking for guidance from CMS on what to require the health plans to provide as far as breastfeeding and nutrition model benefits from healthcare reform. Can we work together to get input to CMS on these benefits?
Sorry, I'm trying to. And I heard RTD too. What I was going to say is the National Business Group, well, I thought I had an answer till the very end of it of asking us to help CMS. But in the meantime, the two things, one is the National Business Group on Health has a model benefit package that has very nicely itemized what services should be covered and all of the specificity that a third-party payer would need. And also, not to invoke Oregon, but Oregon, I know, has had some discussions with health plans about coverage. So that might be a good networking opportunity. And then I guess another piece to the CMS, Medi-Cal specifically, is we have gotten some input from CMS that they are really looking to see movement at the state level that will drive changes at the national level. So, they're really hoping for some model programs to be percolating up from the state level. So that could be a really promising approach.
Just to reiterate that last point, we have had a number of conversations with CMS over the last, I'd say, 12 months about what CMS can do to support breastfeeding. But when it comes down to kind of specifics, oftentimes the answer is, well, we really can't do that until we have a number of states who are already implementing it in their own state Medicaid program. So we really need to get those specific examples developed state by state, tested, proven how they work before the feds can really get through their own bureaucracy to make them into federal standards.
I'm thinking, can you still hear me?
Yes.
Okay. I'm getting a number of questions about, there are many questions and they're in a very small font, so I'm sorry if I'm missing them. We do get a record of all of them. I'm getting a number of questions about the Department of Labor and the request for information, and I just wanted to address that quickly. We do have up on our website, on the USBC website, we have a link as well as some guiding questions, especially for mothers and individual advocates that have real-life stories to submit to the Department of Labor. So we have posted that. We have sent that out on a number of networks and listservs, and I encourage you to go to that and to tell your networks, mothers, advocates, to go submit stories and comments. The more comments, the better. The more comments that are, to also thank the Department of Labor for how flexible and open they have been with their interpretation so far, and thanking, really emphasizing how helpful the law has been and will be. Really encouraging folks to do that individually. So please go to our website. It's linked right off the home page in the news box, right in the middle of the home page on usbreastfeeding.org. And yes, we also are working with some other new work-family organization partners on template comments, specifically focusing first on the questions the Department of Labor has specifically asked. They have asked a number of very specific questions that they need some particular information on. So we are working on those template comments because we're working with some new partners and we're kind of merging them from different organizations. It's taken us a little bit longer, but we do expect that to be ready this week, and we will send that out to coalitions so that you can use those template comments. But what we would encourage you to do is to submit your own comments from coalitions. We're not going to do a joint sign-on letter for this because we have been advised that the more individual letters, individual comments that go in, the better. We're going to be sending out those template comments. You can feel free to pick and choose, write your own comments. If there are specific portions that you have real-life stories to back up, we encourage you to do that within your organization. And just make them as relevant to your individual experience as possible. So we will, like I said, be putting that out. We'll send it out to the designated contributors listserv as soon as it's done, and we're rushing as fast as we can. So that's one question. But do go to the usbreastfeeding.org homepage and look for that link. I also wanted to remind folks getting the question of where you find the handouts and such for this webinar. Audio, that's also linked straight from our homepage. That's in the quick link section. So on usbreastfeeding.org in the bottom right, there is a quick link section where you see the link for the state coalition's teleconferences, and that will take you right there. I think we're getting to the end of the time. I don't know, folks, did you have any other things to add from CDC?
No, I don't think anything from here. I think we're good.
Okay. All right. Well, we do want to try to end on time because we have your regional calls coming up next. And just a reminder that you do need to hang up from this call and dial into the regional number if you are going to participate in your regional networking call. And those numbers were sent to the same folks, proctors, and the designated contributors as well. We will, like I said, have the audio posted in the next 24 hours, and do watch for other emails from us. Many of these other things that we've talked about with the Coalitions Forum, the PowerPoint slides, and that link to order copies of the executive summary and the call to action document. So thank you, everyone, and thank you, Larry and CDC.
Very much. Everybody have a good afternoon.
Take care.
Is anybody there?